Hello, and welcome to today's health webinar. This episode is brought to you by our friends at Site Improve. We would like to remind you that the Q&A feature is available, so feel free to send in your questions and comments throughout today's webinar. We would love to hear from you. And with that, I will turn it over to our moderator, Bradley Fryer.
Hello, everyone, and welcome. Thank you very, very much for joining us today. I'm Brad, and I am a commercial director here at Health. I'm very excited to be moderating this discussion today. At Health, we not only deliver the flagship events, which I'm sure many of you know about or have attended, but we also host events together with our partners throughout the year to ensure that vitally important conversations, very much like this one today, are ongoing. So today, together with our partner Site Improve, we're diving into a topic that sits at the intersection of compliance, patient experience, and health equity, namely digital accessibility in healthcare. With the Section 504 deadline fast approaching on May 11th, many organizations are focused on what they need to do to comply. But this conversation goes beyond regulation. At its core, accessibility is about how patients access care, whether they can schedule an appointment, understand their benefits, or engage with health information without friction. So today, we'll explore not just what's required, but what's possible when accessibility is done well. Before we dive into some of the details today, just a quick note again, Nikita referenced it. If you have any questions, please feel free to pop them in the Q&A, and we'll make sure to get to as many of them as possible. So, without further ado, I would love to introduce our experts today, who I have no doubt will be sharing many, many pearls of wisdom with you. Greg and Steve, thank you so much for taking the time to join us for this very, very important conversation. And I will hand the reins over to you to introduce yourselves. Maybe Greg, we'll start with you, and then Steve afterwards.
Fantastic. Well, good morning, good afternoon, everyone, based on where you are. My name's Greg Gullidge. I work for Healthcare Service Corporation, probably better known for our 5 Blue Cross Blue Shield plans that we administer. And what I do there is I run our digital accessibility program, and very much looking forward to diving into what's just a sea change moment in digital accessibility, and really hope to help people understand the importance of this moment in time. And that's it. Steve,
Thank you,
hello.
Greg. Hey, good morning to you, and hello to everybody who has joined us today. My name is Steve Hennigs, and I've spent the last 18 years at Site Improve wearing a variety of hats with our go-to-market organization, helping companies with their accessibility challenges and opportunities, but also focused in areas like content governance, content performance, and search. Like you, Greg, I'm very excited to dive in today. These are conversations that we're having every day with a variety of, let's say, people along the spectrum of their knowledge of the topic and their readiness and maturity and ability to execute. So really looking forward to our discussion. Thanks for having me.
Amazing. Thank you both for the introductions, and I know I'm certainly excited to get stuck into this conversation today. So I think before we get into the weeds of what Section 504 is and what it means for organizations, maybe we can kind of start off with kind of where and how digital experiences today in its current form are shaping patient access and how patients are experiencing that. Maybe we'll start off with you, Greg, on this one over here. If you've got kind of a personal anecdote that maybe you can share over here, just to kind of help ground it in something as we go forward.
Oh yeah, absolutely. So as a Gen Xer, I'm firmly in the sandwich generation sort of era where, I've got 2 kids with disabilities and I've got aging parents, and really seeing a lot of, how digital options come into play. One, just trying to get appointments and things like that. We have so much going on. We're so busy. So not having to, pick up the phone and try to call and manage calendars and all of that's been really, really good. A really good example recently, though, my father had actually a couple of hospitalizations over the holidays. And without sort of a technology component, it would have been a much different experience. I was able to, as we're going through, we all know like hospitals are understaffed and things like that. But because I could get access to his my chart, which of course he's, pushing 80, he had no concept of my chart. I was able to set that up and see in real time, okay, here's blood work coming back, here's doctor notes coming back, and more importantly, I could even see, you know, when the heart guy didn't agree with the kidney guy, and what's that going to do? What conversation is that going to spark? And then I could take all of that stuff and throw it into ChatGPT and say, what I don't have a medical degree. Help me understand all this. So I could understand things like, oh, they're going to try to send him home tomorrow and we're not ready yet. And those sort of really practical issues without kind of a digital technology sort of aspect to it, we would have just been sitting there for hours and hours or days just waiting for information to haphazardly come to us. But instead, I can be really, really proactive and ask good questions and really kind of know what's coming our way. So personally, for me, that was a really great, sort of use case for all that technology.
Yeah, that's wonderful also to be able to see that it makes your life as somebody who is supporting the patient so much easier. It allows you to keep a patient who in some cases themselves are not as well informed as they might want to be,
Mhm.
to kind of keep them informed so that their overall care experience is so much more positive. Maybe we can look at kind of on the opposite side of that. So you've had quite a positive experience. What are some of the kind of negatives? So when there are gaps that occur, um, maybe you want to dive into that, or Steve, you might also be able to give some insights onto that.
What, Greg, what you just walked through, like let's think of all the different areas where that could have gone wrong.
Oh my
Right. If
gosh,
if there
tons.
if an experience wasn't put together in a way that was that somebody could use, regardless disability or not, right? You have all the appointment booking and form flow that you talked about that right there could have been a barrier to care if
Oh
it
yeah,
wasn't right. You had a mobile app that you interacted with
yep.
for my chart that again could have been a nightmare. Um,
Oh yeah,
but people could have had to make several phone calls. Maybe you get a hold of somebody, maybe you don't understand it, uh, etc. And we haven't even gotten into how you're going to pay the bill for this thing. And there's that aspect of it where this could go
yeah.
awry. Or if there's any, let's say, any documents that would be associated with this that the provider would be sending to you. That again, if not if care hasn't been taken to build them in a
Hmm.
way that people can interact with them, just so many different friction points
Yeah.
exist in our new reality, that there's opportunities to provide a great experience for your dad, for you,
Yeah.
for anybody that wants to interact with a healthcare organization.
Yeah. The 7 different medications that we had coming out of that experience, and not, if we didn't know, which one's covered to what extent and all of that, there's a major financial impact for people on fixed
Yeah.
incomes and those sort of things. So to be able to, help my parents understand those things and what are we walking into, where do you find coupons, those sort of things, it was all digital ecosystem coming into play there.
Well, that's brilliant. Steve, maybe I'll jump to you for this next one to maybe give a little bit more flavor and a little bit more detail. I'm sure on this call there are a few folks who are quite well versed on what Section 504 is, and kind of what their organization needs to do to make sure that they're up to speed. But there may be those who are not, and who this might be one of the first first moments that they're hearing about it. So do you want to maybe dive into a little bit more specifics on what it is, and then as we can continue the conversation, Greg, I might lean to you to kind of give a little bit more context to kind of what this could look like, or potentially maybe being bold here, what this should look like at an organizational level. But Steve, maybe I'll start off with you just to give a little bit more context.
Yeah, so first, before getting into like the weeds of it, um, let's set the table for almost why it exists. And Greg, I'd love your
Oh
two
yeah.
cents on this. This I think a lot of individuals could see this as, I'm going to use the phrase, as a hammer, as a we're coming down. The government is coming down, and it's just you have to do it. But that's at least how, not how I see it, and a lot of folks that I talk to, how they see it. It's more of this is this is a way for us to show that we take equal access to care seriously. And then there is a deadline associated with it. But this shows this shows this shows what's the right word that I'm searching for here? It shows a focus, and it shows yeah, this is an
Like,
important thing that we're going to deliver on. So that's kind of the first part of this. Greg, I don't know if you have anything to add to that.
yeah, I mean, I would play off the focus because it definitely focuses. Overall, it shows kind of a commitment, but that
That's the
focus is
first
really important because I could see you trying to form that word commitment, but I like focus better because that's really what it does. So let's talk accessibility overall and compliance. Compliance generally is pretty black and white, right? Like we think of it in terms of checklists and those sort of things. If you do X, you're compliant. And if you don't, then you're not. And accessibility has not been that way, in no small part because if we think about the Americans with Disabilities Act, the Rehab Act of 1973, ACA to a certain degree, those things predate the internet as we know it, as this super ubiquitous thing that you have in your pocket all day long, um, or in your hand, more in
Yeah.
my hand all day long, honestly. But it makes it really fuzzy. You can't say before the internet exists, here's what compliance means. So you have to kind of come back, and it's super, super gray. Are you accessible? Are you compliant? And it's more of a game of horseshoes and judicial interpretation. So it gets tossed to judges. Judges disagree with each other. So what 504 is doing is starting to introduce a set of objective standards, and I'll start a little bit down this road at least. Those objective standards are a thing called the Web Content Accessibility Guidelines, which forever have just been kind of the de facto, oh, this is it. But it's always been the suggested standard. So WCAG 2.1 AA has long been the suggested standard. And 504 and ADA Title II, kind of the sister rule to this, is taking it from the suggested column and moving it over into the required column. So those 50 success criteria are getting closer to that checklist of do this, do this, do this. And now we have a definition of compliance. So yeah, I would toss that in there too.
hmm And there's also the element, again, before getting into the really nitty-gritty of who are we doing this for? We've talked about I've got four like bullets of who we do this for, mapped out with a fifth bonus ball that we can talk in. So look, there are, I guess, what you could consider, I don't know the right word, but more outward disabilities. There's visual impairment, there's hearing impairment. There are those things that are very can be very apparent when you meet somebody or they interact. However, there's also more your inward potential disability. There's learning disabilities. There's dyslexia. There's all sorts of things there that still impact how somebody is able to work with your organization, digitally or physically, either way. You mentioned your father, Greg. There's
Mhm.
the aging population
Yep,
where now we might have a lower vision or some all of those things it's going to affect all of us at some point.
it's coming.
Yeah, right. The father time always wins. And then there's also a temporary category. I had a colleague, one of our accessibility pros, she fell and she broke her wrist. She now has a cast and has to operate differently, working with a website, right? Or working with an app or whatever it might be. Or folks with slow internet speed. That's not a temporary, but it is somebody who may not be able to watch your video. They're going to need to read the caption. So you have this wide coverage of individuals that you're benefiting because there is now, as you said, this codified date to get to it. And that doesn't include what we would call the curb cut effect. right, of
Mhm.
policies, procedures, etc., that are designed to support persons with disabilities, but inevitably benefit everybody.
Yeah.
Where we put cuts and curbs in the 70s so that folks with wheelchairs can get up and down curbs with ease. I use it every day, and
Yep.
it is a better experience for me, and that's true across digital properties, digital interactions, etc. So again, before we got into the weeds, there's anything to add there, Greg, around who we're doing this for?
It's really broad. I mean, when you start talking about accessibility, there's a very lift all boats component to it. Digital curb cuts very much exist. Um, Captions, are my favorite one. Whenever the kids were babies, we didn't want to wake them up, so we turned captions on the TV. We never turned the captions off because we didn't realize how much we were missing without the captions on. So yeah, highly urge, whether you're in the deaf and hard of hearing community or not, check out the captions. It adds so much to it. So yeah, it introduces kind of an intentionality of how usable is what we're making. So whether you're specifically saying, okay, I'm trying to adjust color contrast for someone who may be low vision,
Mm.
that's going to help absolutely everyone. Just taking some of the burden off your eyes. We stare at screens all day long, our eyes are very burdened. It's going to help everybody. So there's a ton of that, yeah, lift all boats component to what we do here. Definitely more specifically, the disability community. It's the primary, but it's very broadly applicable.
I think, I mean, across, and this is maybe a smaller segment, but those kind of people who are not currently living with a disability, or maybe are not aware that they are living with a disability, and that how these kind of changes will really, again, help lift and elevate their experience when it comes to engaging with and or receiving care. Which is, again, it's a component which you don't necessarily think about. A point that you made, Steve, when it's like somebody who is temporarily, for example, they've fallen and they're not able to walk because they've fractured their hip or something like that. And you can just imagine how, like, you've been doing something the same way every single day because you can, and now all of a sudden you don't have that ability, even if temporary. How and having measures in place that still enable you to get high quality care. As to your point, Greg, kind of making sure that everyone's actually benefiting from all of this. Should we dive a little bit into the details in terms of what Section 504 is, and maybe kind of a few kind of practical measures that organizations can start to implement? Because it's one of these, I think there's always this fear that, you know what, oh God, it's either a 0 or 100 here. We either are or we are not compliant. And I think maybe we can kind of chat to a little bit about that to hopefully kind of help people understand that this is, as with most things, this is kind of part of an overall process. Steve, do you want to maybe start off that, or Greg? Either the two of you. I know you've both got plenty of experience
I'm
here.
happy to start. So Nikita's going to help me out here by throwing a link from hhs.gov into the chat for everybody to absorb. This link is frankly just the nuts and bolts of Section 504. This is what, you can, and it's a fact sheet, so it's a quick read up and down that everybody can read, share with counsel, share with compliance, share with experience, etc., just to help set the table for, am I included? Do I receive federal funding to the letter of the law of what this is? And that's documented out in there. If I am a recipient, do I fit the definition of recipient? So there's
Mhm.
that fun definition that we can spend some time on. And then what is the actual deadline? So Greg, I wonder if you might be able to expand on some of those points. I could put some color in, but those,
Yeah.
do I count? Like, am I in or out? How do I fit
Right.
this?
Oh yeah, and you really kind of hit, like, here's your ticket to entry, and it's that phrase that you were getting at there, this super non-sexy phrase, a recipient of federal financial
That's
assistance.
it.
That's the phrase, and I had to close my eyes and envision it because it doesn't really roll off the tongue. But if you are a recipient of federal financial assistance, this is your ticket to get in on this. So in my world, and in healthcare, that means Medicare, Medicaid, working in the exchanges, those sort of things. And very astutely, Steve, you mentioned this. This definition has changed over time. There has been politics involved in this. So, me at a big payer, we were in the bubble, we were out of the bubble. Now we are in the bubble again. So it's worth checking with your legal department. I'm I pretend to be a lawyer a lot in my job, but I'm not actually a lawyer. So follow up on this stuff. But that's really kind of what gets you in on this. Now, how deep do you want me to go on I can give you some of the highlights of what's in 504. Should we go there
And I think the recipient thing, Greg, is worth
a little
expanding
more?
on because it's not gray. It is black and white, and then there's gray.
Yeah,
I
yeah.
hate to say it. Because if you're like, I'm going to give an example and then hand it back to you. But let's say you sell a service to a provider. You sell, let's call it medical equipment or something there. It could be that in your contract with said provider, they are requiring you to adhere to Section 504. Therefore, you are a recipient in this case and must follow through. So there's some of that nuance, but if you could provide just kind of the lay of
Yeah.
the land there, I think that would help everybody.
So it's one of the big sections. I I read every single word of this. For some reason, I went through every word of it, and there was a phrase that stood out beyond the federal financial, all of that. And that phrase was, "You cannot contract away responsibility." And so this phrase, contract away, was really prominent, saying, okay, you're still on the hook. If someone, and we're talking about civil rights issues here as well. So something that can be construed as a denial of service, because your website's inaccessible, your mobile app's inaccessible, those sort of things, you're into this realm of civil rights violations, and Health and Human Services Office of Civil Rights, may engage in an investigation of what you have going on. But if it's something that, oh, our vendor runs this website, it doesn't really matter under 504 because you can't contract away that responsibility. So now it becomes on you. The way I'm looking at it and how I'm building it out is an annual attestation process. So every vendor that we have, I'm going to ask them to fill out a voluntary product accessibility template, a VPAT. And that's kind of I talked about WCAG 2.1 being the de facto standard. VPAT's kind of the same thing. It's the de facto standard for saying, here's how accessible we are. That degree of accessibility relative to those, 50 success criteria. But you're covering yourself a little bit to say, okay, we talked with our vendors, we're having this conversation, we're actually getting some documentation back from them every year. And we got it baked into the contract now. So it's part of our master service agreement to say, you will be accessible. If you want to do business with us, you have to do that. So, and it really kind of comes back to that phrase, you can't contract away responsibility. So, yeah, a pretty big component of 504 with that vendor relation piece.
And and Greg, what just to get really specific here on the our time frame and things like that. So if you're an organization that is a recipient of federal financial assistance, I'm going to steal
Mhm.
your verbatim, and you have more than 15 employees by May 11th, 2026, the letter of the law says you should comply with WCAG 2.1 levels A and double A, right? That
Mhm.
is what this deadline is.
Yes.
Um, and so that is getting, as you kind of alluded to, getting your house in order with web, mobile, kiosk, etc.
Mhm.
But then also through contracting vehicles, ensuring that your third party partners also are following said standards. Is there anything you would change about what I just walked through right there?
No, accessible procurement. It's been, it's the last 2 years in particular in the accessibility industry, accessible procurement and, developing some real standards and practices around it. So that means if you have a policy, make sure that it's included in your policy. Build out some processes around, like I'm talking about, collecting those vendor attestations every year, which is so much harder than it sounds because yeah, there's so many different points of contacts. There's so many different degrees of understanding. Some people will take it and just say, "Oh yeah, I can do this." Some people will freak out and say, "We have to hire a consultant, and this is going to take 6 months." And you might intervene there to say, "Here's what we can do." Um, yeah, there's a lot around that, but I think you're on the money with what you tossed out.
But I want to double click on something you said there because I think it leads into it contradicts what I said, but that's important. You said the word process and,
Yeah.
and having a process in place. And that's one thing that we end up speaking with just about everybody about who wants to talk 504 is holy smokes, this deadline's in 6 weeks. We haven't gotten started. Are we going to be fully compliant on all of these spaces by May 11th? And I'm happy to say no, that is not the
Right.
spirit. I'd be very interested in your perspective on this. And as part of that, I'm always happy to say you may feel different. In the nearly 20 years I've been doing this, I've never seen an accessible website. 100%. I've
Right.
never seen a
Right.
100% always on accessible website. It
Yeah.
is a hard a hard thing to chase down. But maybe could you share your point of view on this process side?
Yeah. Yeah. So many thoughts off of that because, as you say, that perfection, and this comes back to, especially in businesses, that we work in, if we're the accessibility person, there's probably a perception that there's a checklist and you can check those things off. Reality, you probably won't get 100%. And that's why even within the VPAT, there's a little bit of leeway to show, hey, we're working on it. Um, that said, and I want to make sure I get back to the process part in just a second, but I want to include this part too. Um, Within the rules, they called out specifically a practice called notice and cure, which is somebody told us about a problem, so we're going to fix it. And so there's a couple of avenues. Like, no, I don't think you're going to be held to complete perfection, like May 12th at 12:01 a.m. I don't think there's an alarm that's going to go off that your website is going to explode if you're not 100% compliant. Um, However, one of those avenues that people have used was notice and cure, which hey, they told us about a problem, we're going to fix it, so then it's copacetic. Um, yeah, okay, so that's kind of shutting down as an avenue, like as a panacea to get away from responsibility. Now, process though. So knowing that you probably won't have a 100% all 50 success criteria checked off, um, I really think that the industry is starting to talk more about moving towards more of an ISO 9000. Like, do you have the infrastructure in place? Do you have the process in place? Because WCAG is a moment in time. We looked at our website, at noon on Tuesday, and it fit all these criteria. That's great. But what about Wednesday? You know, have you trained designers? Have you trained developers? Can you build accessibly? Do you talk about disability? And this is a big one that a lot of people miss. Talk about disability with folks. That's been some of the best conversations I've had is with a group of designers I was doing a training with. Somehow I got to spend 3 hours with them, and we spent at least the first hour just talking about disability, and it was fantastic. But designers, developers, testers trained on board. And then Do you have, process for monitoring, for watching? You got the pre-production covered. Do you have the post-production covered? And it's kind of two phases there. So pre-production, do you build accessibly? Post-production, do you have tools in place to monitor and find problems? Do you have procedures to get stuff remediated when you do find it? And that's where Site Improve has been so crucial to us. I'll put a shameless plug in there because I would be completely lost. I'm shameless. I love Site Improve. So I gotta throw it out there. But that back end, the post-production environment, I'm a one-person shop. So there's no way I could go scanning all these websites all day long by myself. You have to have some tooling in place. And then undergird all of that with accessibility statement, accessibility policy, a community. We have a robust center of excellence because accessibility, when it's done in silos, it doesn't work. You have to have left hand and right hand. So I have this center of excellence that it's got designers and developers, but it's got lawyers and procurement people. It's also got people with disabilities. So we can come into a forum together and a designer can say, I'm working on this. And then one of our low vision employees can test it in real time and say, this works for me or it doesn't. And that's kind of the whole enchilada. So I'm hoping that we can keep WCAG. It's okay to have something to attest to. But do you have the infrastructure in place that's going to keep you producing accessible content and managing that accessible content? That's really, I think, what's going to keep you on the right side of 504, of ADA, of ACA 1557, if you play in that space, all of it. So, sorry, that's a lot, but that's really what I spend most of my time thinking about.
Well, I think it's really apt that what your job title is, Greg. Program. It's a
Yeah,
program, right?
the
And
program.
we have a saying in Site Improve that accessibility is a process, not a project. This is a living
Mhm,
thing. It's just like privacy and security and all. You said ISO is a good like thing to reference of
mhm,
this is something that needs care and feeding um
mhm.
in a consistent basis. And what I hope that folks found helpful there was you did walk through essentially all those building blocks of preventative measures, of post-production monitoring and reporting, but then also of process and documentation around these pieces, as well as the actual living people that
Yeah.
you've brought in to do this. Um, And Brad, I don't know where you want to take the conversation from here. I know we've got a business case section that I think is worthwhile, but what makes sense as we kind of
Yeah, I
continue.
think it was really helpful to kind of, again, as Greg kind of alluded to, all the various different building blocks that come together to ultimately not only kind of allow this to happen in the now, but also in the future. But maybe we can jump. There's a question that's come in, which I think is particularly kind of relevant to the conversation we've had now, which is, the deadline, as you mentioned, Steve, is I think just 6 or so weeks away. It's not, or even less actually.
If you want.
It's not far away at all. So what would you, and maybe you can both give your viewpoint on this because you're coming at it from different sides. Do you believe is the sort of single most critical triage step that a healthcare system that is behind schedule um, could take to kind of mitigate their highest legal and patient care risk?
So I'll take this first, Greg, then you jump in
Yeah.
because we literally had this conversation yesterday with somebody. So one, you've got to know essentially you got to know what you're up against. If you are quote unquote behind. So there's some sort of audit of your ecosystem, right? Their website, if you've got an app some sort of audit. And the website's likely the most used asset of yours. So that's probably the best place to start. So some sort of audit while also starting to think about some of those foundational building blocks of documentation that Greg spoke about. So what are we up against? audit, some sort of plan, start thinking about the long-term care and feeding of whether that's monitoring and folks we need to involve, some of that. But an audit and an accessibility statement,
Yeah.
I think, are two like really strong things to have in place before the deadline. So you know what we're trying to attack, and you also have some sort of response agreed upon internally that you're willing to put on your website that says here is how we're going about this. But Greg, what would you add to that?
Yeah, the statement was the first thing that I did. A statement that calls out just call it out, WCAG 2.1 AA. Like, and you can say this is what we aspire to. You don't even have to say like this is what we have. Um, and people that do, it's not a panacea. Like everything's not going to be completely WCAG 2.1 AA. It just moves too fast, especially if you're a bigger company with lots and lots of digital footprint across different channels and things like that. It's okay to say that you aspire to 2.1 AA. Policy kind of comes in as well, in terms there just to codify it and hold people to it. Um, I would echo a lot of what you said. It's like you got to kind of know the lay of the land first. Um, there's a couple of ways to do that. One is with the automated scans. So you can't do everything with automated. It's going to take some manual testing, but at least get a start with running like a site improve browser extension. Go into your page, run it, and it's going to call out. Okay, here's specifically to WCAG, and the different levels of degree of accessibility. There's an issue with this, and it's going to show you right on your page. Here's where it is. So it's a great place to start with those. Um, Support it though with a couple of simple things. Do a keyboard test. Probably the biggest piece of assistive technology that is out there, even beyond screen readers and all that, is your humble keyboard. Can you tab all the way through your website? Can you shift tab to go backwards? This is going to take you, a minute to see, can I get to every spot? And a lot of my manual testing is really kind of a game of, can I get to it? Just using the keyboard. If you can do a screen reader test, pull up, you probably have one baked in. If you don't, MVDA is free, but can you use a screen reader and try to get to it? So combine those things, do some automated testing, use a scanning tool. I like the Site Improve browser extension, and then do a keyboard test and a screen reader test if you can. And that's going to give you, some pretty good information about where you are current state. You might also attempt to fill out a thing called the VPAT, the Voluntary Product Accessibility Template. It's put out by a group called the Information Technology Industry Council. So if you want to get the most current one, there's different types. If you're in the United States, don't fill out the European Union version. It's much longer. I've seen people do that before. So really look at what you're doing. You probably want to do a WCAG version and not a 508 version. It's a little bit different. 508 is kind of a subset of WCAG. It's just WCAG 2.0. So if you might hear that, it's just to demystify it a little bit. Um, but yeah, and granted, that's like 15 things to try to do, but that would be the starter set.
Greg, I hope you don't mind. I had Nikita share your accessibility statement on
Oh
the
yeah.
IL site in the chat, and then I think she'll also share a link to the VPAT
Oh, there it is. Perfect.
that you mentioned. So those are great. Just to follow up on one thing you said that is always interesting. Um, this balance of automated and
Mhm.
manual testing, I think is a misconception or a hard hurdle for folks early in the game to get over. Um, There's technology out there, Siteimprove included, that can automatically scan websites, right, and find these issues. Uh, all of us can only find 50 to 60% of accessibility issues through automated approaches. Um, I don't know if my count was exactly right, but I think there's 26 guidelines within WCAG A and AA that require manual hands-on keyboards using assistive technology to find. Um, so as you think about this audit in your org, make sure you have both if you want to have a true picture of kind of level of effort and what you're working with as you work on some of the other things Greg outlined, like a statement, like a VPAT, like organizing the troops internally, those types of things.
Yeah. And if you can't underscore enough, if you have folks in your company who have disabilities, please include them in the process.
Absolutely.
There's a phrase in the disability community called "nothing about us without us." And I run our employee resource group for people with disabilities. So we get involved a lot in accessibility testing and things like that, because that voice of lived experience is unbelievably valuable. So yeah, keep the "nothing about us without us" flag close at hand if you can.
I really like that. That is a statement and something to keep in mind. And actually is a nice segue to kind of the next part, which is kind of moving beyond compliance and looking at how accessibility can influence kind of patient trust, patient engagement, their overall care experience. And I think linked to and downstream of this, also how accessibility can act as a business driver. Steve?
I'm happy to start, but
Yeah.
Greg, we're gonna play a lot of back and forth here because this is, this excites me, this topic, because
Yeah.
doing the right thing often turns into the right thing for business, right?
Yeah.
I would, Nikita, if you could possibly share in the Forrester link to the group. They've gone to great lengths. And then Nikita also, if the Siteimprove link. So there's two different links you all can peruse on what is the business case here. I'm a big left brain thinker, so I need to see the math on this. So how does the math work out? And between the two of us, Forrester Siteimprove, and frankly any other case worth its salt, you can see revenue is the number one business case for doing this. And then there's a decreased cost element, there's an improved resilience element, there's a build trust, like Brad, you called out, element. And then finally, there's the reduction of risk at the tail end of it. Providing a great experience leads to higher traffic on websites, better engagement with sites and mobile apps, higher conversion. You're removing barriers to doing business with your company in a very meaningful way. There's another aspect I'll touch on, but Greg, this is something I know that you spent a lot of time on.
Yeah. Let me start with tell all your stakeholders that they matter, that you care about them. One, that we're talking about health. People in disability community tend to need their health insurance, if they're lucky enough to have it. So by all means, please make sure that you're taking them into account and saying your experience matters to me by getting out in front of it. Then we get into more of the revenue stuff and all of that. Making sure that people can log in, especially like a member portal or something like that. That's a place where a lot of folks will fall down. For whatever reason, it's so hard to prove I'm not a robot over and over and over again. It feels like it should be a slam dunk, prove you're not a robot, but I struggle with it. So yeah, there's so many ways that you can leverage accessibility to bring more people into the fold, and not just sort of the obvious ways like the color contrast and those sort of things. Cognitive really pops to mind. Like putting that sort of middle school reading level as a standard out there, so that you don't need a PhD, you don't need insider knowledge of 1,000 different acronyms. Make your stuff accessible in that way, so that everybody can have a rich cognitive experience. The neurodivergent umbrella is massive. Account for that as well, as you're building out your products and you're rolling it out. But yeah, in terms of the business case, it's about inclusion. It's about not stopping people from interacting with you. That's going to lead to those revenue opportunities as well. Uh, and people know when you do it genuinely. People, it comes across. It's the blueberry muffin analogy, and I'll dip into it in just a second. If you haven't heard the blueberry muffin or the chocolate chip muffin, whichever one it is, but it's this concept of like when you bake a blueberry muffin, you have all these ingredients, the eggs, the sugar, the flour, all that stuff, and you put them all together and it makes a muffin. Now, if you take the blueberries and put them off to the side, you can put all that stuff together and create just a regular muffin, and there's nothing inherently wrong with it. But if you're a company that sells blueberry muffins and you have to take those and just shove it in afterwards, it's just a mess, right? And we do that with accessibility more often than not, where we're trying to shove the blueberries in. And that's the experience, is this mangled muffin. So get out in front of accessibility, bake the blueberries into the product, and it's just going to be a better experience for everybody.
You're hitting on, I mean, the cost savings of that analogy alone
Yeah. Yeah.
are just tremendous, of having to rework or whatever it might be, organizing resources, the opportunity cost of all the time
Mhm.
that takes to redo it, and how many folks are likely excluded with that approach. And then there is that trust element of
Yeah.
when you know, when you see it, you see it. That type thing of you have a good experience on a website or in an app. That's one of those signals, right, that this company understands
Yeah.
me and cares about me. So I think it's a really good analogy, Greg. Really good.
Can't take credit for it.
I've seen it on a few of your slides.
Yeah.
Let's say
I
that.
use it constantly, but yeah, mostly because I like muffins. But
The last kind of business case thought I wanted to leave folks with is more on the thing a lot of us are talking about, and that is AI search, AEO, GEO, etc. And you might be thinking to yourself, Steve, what the heck are you doing here? Talking about search in an accessibility discussion. This could be a whole webinar on its own, but foundational principles, semantic HTML, well-structured content, descriptive metadata, a lot of things that are found in the WCAG guidelines are immediately transferable to what is going to be the foundation of success for companies trying to win in the AI search world. If your content can't be found, if it cannot be indexed, and if it cannot be understood, the quality is secondary. So having those strong bones is step one to showing up in ChatGPT, to being part of Google
yeah,
AI Overview, those types of things. So that is it's another kind of arrow in the quiver, if you will, of the business case for why you're doing this. Because robots, your assistive technology reads the website the same way Googlebot does, reads the same way, the LLM fetch does. It still has to
yeah,
go through code. So you're really doing yourself a strong favor on that side of things as well. Again, you're just doing the right thing, and it's the right thing for business.
yeah. I'll tack onto that real fast. I don't know a ton about AI and accessibility yet, but it's unbelievably important, I think, for us in the accessibility community to really dive in there. And I'm going to borrow a phrase from Nandita Gupta, who used it in a webinar we did a while ago, um, talking about AI and accessibility, the risk of which, if we're not diving into it and figuring it out, it was exclusion at scale.
Hmm.
Yeah, and though that phrase just shook me to my core. Exclusion at scale, as we see AI just becoming, on the fast train to ubiquitous. Um, yeah, we have to figure that out. And I'm glad that you bring it up and that you're thinking about it too. So I'll leave it with that.
Maybe I see we are rapidly approaching the end of time. So maybe, Greg, I'll post one question to you, which I think might be helpful, and then there are a few questions which have come through that we can maybe answer.
Yeah.
Is maybe you could share your own experience of having kind of built a kind of Section 504 program within your own organization. So maybe you can just kind of give us, I appreciate that so much has been done over the years to get in this. So to ask you to kind of put it in kind of in summary with some learnings is a challenge. But if you could sort of provide a bit of color to kind of the process that you've gone through to build a
Yeah.
program as successful as what you have.
Yeah. And I stood up my program about 4 years ago, um, following about 2 years of groundwork. And that groundwork has probably been the biggest key to having to giving the program legs. And that was sort of after having the epiphany of how important this is, coming back to my company and finding all the different pockets of people who were doing accessibility and then bringing them all together into one conversation. And it really took a couple of years, and we're still finding folks who have a stake in this conversation. But that was job one, was just getting critical mass of people who were engaged in the topic in some way. And then we could play it forward into the business case, into the policy, into an actual program that stands up from that. So yeah, if you're looking for sort of, what were the really basic building blocks, it was building the community, and then it went from there.
Perfect. Thank you for sharing. I think
Yeah.
I think for we've kind of alluded it to a few times. Like it takes all the various different components really coming together to make this work. All right, I'll jump into a couple of questions and then I will then ask you for your kind of closing thoughts. So the two questions you have come from well, there's a few, but there are a couple from some anonymous attendees. So I'll read them verbatim, and then we can kind of go from there. So speaking to automated scans, we have leadership getting stuck on satisfying the automated scans, but ignoring the need for manual testing. How do you recommend we encourage and enforce the manual testing needs?
Man.
Difficult question. Steve?
Yeah.
I don't know if it's that difficult, because if and maybe this is something either we or someone else can help with, of just a flat readout of the split of, hey, you're ignoring
Yeah.
half the requirement, essentially. In terms of leadership likes a good document, so why not just say this is 50% automated, here's the 50% manual. We get beat up either way, right? If
Yeah.
if the risk doctor comes calling. So I think that is at least a starting point for, hey, we're still heavily exposed on the risk side of things.
Yeah. Right away, my head went to kind of the profit in the hometown thing about, e- for whatever reason, leaders tend to need something externally, and there's a lot externally that you can find about, you know, uh, automated testing covers X%, and there's some, there's not a good, like, solid scientific number of here's the percent that it covers and here's the sort of the most prominent issues being covered in it, but there is total agreement that it only covers 8%. And if they're in that black and white checklist mindset, then you can say X% of the checklist is dangling out there. So yeah, I would find the outside information, bring it in, and say, here's how we solve this gap.
Perfect. The next one is more of a technical question, and perhaps Steve, you could speak to this one. It says, please address how to traverse PDF files from multi-page health resources in a web page. HTML does not accommodate these resources.
True. I'm glad somebody brought up the PDF elephant in the room.
Right.
We're going to have to talk about it at some point. Um,
Exactly.
for the first thing I would say is not as technical, but it's going back to the HHS kind of fact sheet of, okay, what do we have to do first? What do we have to attack first? Because there is kind of there's a break of kind of archived PDF content, for the most part, is not part of 504 unless it is a key aspect of how you deliver a program, right? Or Greg, maybe you can put a little more flavor on that. But there's that piece here of what are we attacking, right? And then there is tooling out there that can audit all PDFs on your website, and at least gives you a starting point before you then maybe deploy a more manual approach to maybe some of your more, let's call it prominent, etc. PDFs. But then Greg's whole build it into the process. Now we got to start thinking about how do we develop and deploy for future PDFs. Though, how do we get that into our process so we're not doing this reactive piece to it? Greg, what would you add to that?
It's another channel, and you've got to cover all the channels. I mentioned web and mobile app. Electronic documents is one of the channels, and the rules outside of like WCAG 2.1, and maybe even including, they devoted so much real estate to PDF documents. Yeah, and sort of if it's before this date, but it's not used anymore, if it's truly archived, it's outside the circle. If you have to log in and it's not customized to an individual, it's outside the circle. If it is customized to an individual, it's inside. If you have to log in and it's still in use, then it's inside the circle. It's one of those things, like the biggest one is if it's needed to access care and it's current, like if it's 1999's information, you don't have to worry about it so much. But if it's still in use, then you have to address it. The problems with PDF is it's so stinking technical and costly. So I think there's much more to come on PDFs as people are starting to wake up to this topic, and that it's as hard, if not harder, to remediate a PDF than it is a website a lot of the time. I mean, that kind of blows people away when I tell them that. Yeah, it's super expensive. There's a ton of work that it takes. I think the industry is starting to catch up with some AI stuff in here. But it's probably a couple of years away. So I think that barrier to getting PDFs really wrapped up is probably coming. It's kind of a work in progress. I know there's a lot of pushback on the ADA side with people saying, this is our yearly budget plus to remediate these PDFs. And so that's causing a lot more conversation. I think we'll see some changes around it, but there's a whole specialized field on PDF accessibility. So dive into it. It's still very much within the rules, but yeah, know that it's a can of worms and it's going to take a lot of attention, but put the work in on it. I wish I had a better response. It's such a toughie.
It's a tough area. So
Yeah.
I think just to wrap things up, I know we're almost at time. Greg, Steve, you've both been absolutely phenomenal today. So thank you for kind of providing all of your deep insights on this massively important area. Maybe we'll finish with just one question for both of you. So if you could give sort of healthcare organizations and kind of leaders who are part of this webinar today, one piece of advice to move from kind of reactive compliance to truly inclusive digital care. You've touched on this a lot. What would it be? Just kind of take home sentence if they remember nothing else about today, although hopefully they'll remember plenty of the anecdotes.
I want to go back to just the process versus a project thing here. Use this as an opportunity to start building a scalable process that will have an outsized benefit to your organization for the resources that you put in over time. Yes, there's a deadline coming. The boogeyman's here, whatever you want to say, but that this is an opportunity, not a penalty is what I would leave people with.
Amazing.
Yeah.
Greg?
That's a really good one because, I mean, the European Accessibility Act was kind of similar. It took effect last May and it didn't start raining lawsuits like crazy. Take this opportunity. Don't be afraid. Find friends, share passion, get other people passionate, and build that momentum to do the absolute best that you can in total earnestness. Do the absolute best that you can and just pursue it as hard as you possibly can.
Amazing. So with that, again, Greg, Steve, thank you so much. Thank you also very much to all of our participants. I hope that you found today's session insightful and useful, and you can take a lot of these pearls of wisdom back into your own organizations and break the various different Lego blocks together to kind of truly make care accessible to all. All right, Nikita, over to you.
Thank you to Site Improve and everyone that joined us today. Please visit our website, hlth.com, to catch up on all health webinars and watch the recording of today's session. Join us in Amsterdam, June 15th to 18th for Health Europe.